hello, everyone, and welcome. I am very glad to have with me today my dear friend, Philip Jennings from Treutlen, Georgia. Glad to have you back again, brother.
Thank you, James.
Thank you so much for taking time out with us. Philip is the CEO of Choice Care Ambulance Service, amongst other things, but today we're excited. Great news coming out of Treutlen County, your hometown, right?
Absolutely, James. We're very excited to be awarded the contract down in Treutlen County to provide advanced life support services for the citizens of Treutlen County and the great other people that travel through our county.
Yeah, and you know, that's what I was thinking when I got the text about 11 o'clock last night. Y'all had a long county commission meeting, didn't you?
It was fairly lengthy.
Yeah, I'd say so. And I go to bed early, so I got the message this morning when I got up. But it was great news to wake up to. But, you know, I was thinking about that also because, well, just yesterday, my grandson had an all-star game in Vidalia. Where did we try? How did we get to Vidalia? Right through Treutlen. So if my family was in an accident, I'd hate to know that we didn't have advanced life support available to us or my family or kids or whoever. So it don't just affect the people of Treutlen County, does it?
No, it doesn't. And it affects all the citizens coming through our great county. And we have never landed helicopters in the county for trauma events. There will be a vast amount of changes going on in the county. We will be having what we're calling LZs, landing zones, positioned throughout the different fire districts over the county. And if we get a stroke victim, our paramedics are going to push drugs by direction of our medical director, and they're going to do everything they can, just like you were in an emergency room, and they're going to try to make sure that you don't have any lasting effects from that stroke, if at all possible. Going to put you in a helicopter and going to have you in Augusta at one of the best stroke centers within a matter of minutes. Yeah,
and that helicopter is so important. As we know here in Lawrence County, it has saved lives. I've been on the scene and watched it land in just minutes. You're at Macon or Savannah or whatever. So that's great news, not only for Treutlen County, but for Choice Care Ambulance, you know, and with you, it's always customer satisfaction. You're taking care of the customer. It's customer service and employee service. Tell us a little bit about Choice Care.
Well, there are two of the owners of Choice Care, the stockholders that live in Treutlen County. My mama lives there. A lot of my friends live there. I mean, why do we deserve any less quality of care than the citizens of Lawrence County or Toombs County or any other county for that? We don't.
Yeah.
We deserve to have that same kind of service. And for the people that are coming through our county, they deserve that same kind of service as well. The current provider of the services was certainly providing what he was under contract to provide. Mm-hmm. It was just there was a lack of education on the part of the commissioners to understand that there is more available. Mm-hmm. There is more than a taxi ride that's available in the EMS world today. And we want to bring those advanced life support. We are so fortunate to have people from all over the state. It's amazing. We've got paramedics who have been working at the medical center in Macon, one of the premier trauma events. Yeah. Listen, we want to come to Treutlen County and help you guys. How much can we come down there and work? We only work 2 days a week at the medical center. We get our 48 hours in there, and we'll be glad to come and work. We've got paramedics that we consider probably some of the best in the state that want to come to Treutlen County and work.
Wow.
So many people in the EMS business, they want to give back, James. It's all about saving lives.
They're not in it for the money.
No.
I mean, you know that. I mean, and I know you take care of your employees, but it's just not a top-of-the-line compensated field. You got to love what you do.
That's right.
And then with this, and they're going to be linked to these hospitals. You'll be able to communicate. You got a medical director. You're going to be, while I'm in there, say I'm having a heart attack, you can be communicating, and they'll say, put 5 cc's of this, do this. So you're already saving my life en route to the helicopter pad, en route to Fairview, en route to Meadows, en route to wherever.
That's exactly right.
Macon or wherever you have to take them. But
there'll be times that you know, if you've got multiple broken bones, there is no reason in the world not to push some morphine. We've got to realize we've got a 30-minute ride at best from Treutlen County. We're that far from a hospital in most cases. Mm-hmm. From the time the call comes in, you at minimum you're 30 minutes to the closest center. We are fortunate, though, to have a trauma center at Macon. Mm-hmm. So if it becomes, we have one of course, there's one in Savannah, one in Macon, one in Augusta, and of course Atlanta has two. But we're very fortunate to be fairly close from whichever end of the county we're on. If we're on the Toombs County end, or where it butts into Emmanuel County down at Highway 297, mm-hmm. we may be a mile or two closer to the trauma center in Savannah. If we're on the northern end of the county, say Highway 15 north, we're closer to the trauma center in Macon. So helicopters will be directed if there was an accident on the interstate. But let's just suppose you're a citizen. Let's suppose you're having a stroke. All of a sudden, the side of your arm goes numb, and you know you're having a straight stroke. Your speech is slurred. Mm-hmm. Get a paramedic there. He can administer some drugs just like they do in the emergency room and stop that. Yeah. Strokes are almost reversible today.
Yeah. If you get it early, and like a heart attack, those first few minutes, we know, of course. Yeah. I didn't mention, but Philip worked his way through college as an EMT. So, I mean, you've been doing it for a long, long time. And that's why y'all really do care.
Yeah, we do.
If not, it'd be a long day at work, wouldn't it?
That's right. It would be. And our people, it's amazing the stories that we get told now by our medics. Things they do. We have a situation where we transported a patient across country. The patient had been unconscious for 18 months when we started out with this patient. By the time we got across country, our paramedics and medical doctors along the way figured out some things to do, and that patient is up walking around today and has already called us back and said, "I want to give something back. What can I do?" So there are miracles that occur out there. Amen. when you team up with the right doctors, the right medical care, the right EMS services. There are miracles that occur. And we want to do a lot of things in Treutlen County. We want to map that county. We want to do advanced things of 911. Say, for instance, you lived in Treutlen County. If you've had a prior heart attack, if you have a medical history, if you're on certain medications, all of this is going to be voluntary, but we can enter it into our database. If we get a call to your residence, the paramedic, before he gets there, he already knows, okay, Mr. Deal has already had a heart attack. He is on this kind of medications, and these are the things I can do. Yeah. He has some time to think about it before he gets there. So we're going to do those things. We're going to implement procedures into the school system. We want every senior, we will, if they allow us to, every senior that graduates from Treutlen High School will have an American Heart Association card, will have passed the test in CPR training. Man. And we want Treutlen County to be a very safe place. If you have a heart attack, somebody's going to be pumping on you till the paramedic gets there.
What a great program.
Oh, we're happy. We're excited about it. It's Treutlen County.
What a great program.
And we have intentions of launching some things in Treutlen County that has, we're working with a very large team of doctors from around the world, and can't talk about it at this point. This will be maybe another conversation later, but we are going to launch some revolutionary technology in Treutlen County that'll be the first of its kind in the EMS world. Wow. And it'll be a launching pad down in Treutlen County. So we're pretty excited about some things we're doing.
We're going to hold him to that. We're going to get him back on that one because we need to keep it close to the vest, don't you? Y'all do a lot in the community. And, of course, you've grown up in Soperton and Middle Georgia, Lawrence County, Montgomery. We're all really tied together. You know that. We're regional. Y'all do a lot of work in the community. It seems like everywhere I go, Salvation Army, collecting food for the hungry. I saw Clint and his family up at the EMT Day in Macon, just doing things. You mentioned the high schools. Our children are so important to our community, aren't they?
Yes, they are. And we want to be a source of education for our kids. I mean, there are so many people that come to a very bad ending by, for instance, texting on a cell phone while you're driving. And we've probably all been guilty of it.
Oh, yeah.
But to reinforce that and to do things like, okay, we're going to put a car at the school for 2 weeks out of the year or 2 weeks before graduation to remind them the beginning of your life is ahead of you. And to save lives is what EMS is all about. We are of that spirit. We've got to give back. And we do a lot of activities. We will be participating in a lot of activities in Treutlen County. They just had a run down there a few days ago. We'll be assisting at churches when they have special events. We'll have one of our paramedics there doing blood sugar analysis, doing blood pressure checks. We're gonna be about community health down there. We're working on an arrangement right now with a hospital to put a clinic back in Treutlen County. Healthcare is a problem in Treutlen County. We have a lot of poor people in Treutlen County. Yeah. We have a lot of uninsured people in Treutlen County. And just because you're less fortunate than I am doesn't mean that you don't deserve the same level of care.
Amen.
And everybody deserves, I just believe that everybody, I don't necessarily agree with a lot of the new healthcare rules because I think there's going to be a large segment of people that are going to suffer from a lack of care that's going to result from some of the rules. But we're going to do our part, hopefully, in Treutlen County to bring healthcare back a little bit. I remember when there were 2 doctors. I was born in the Treutlen County Hospital. Not a lot of people can say that, but I was born in Treutlen County Hospital. The doctor that delivered me has been gone for many years, but we probably won't ever have OBGYN or a hospital back in Treutlen County. But we can bring the medicine
Amen.
To the county.
Yeah.
And that's what we're going to attempt to do.
We got to. Because like you said, no matter where you are, you deserve good health care. Speaking of awards now, y'all recently won, I think, a couple of World Safety Awards. Is that right? Boy, that's in our corporate office, if you're not from Dublin, Choice Care's corporate office is here, and to win a World Safety Award, how does that happen?
Well, we're trying to be innovative. We most of us were not involved, the stockholders of Choice Care were not involved in the medical field. The only one is, of course, Dr. Avery. So we approach it more from a business standpoint, and we're looking at how do you improve things, how do you make it better. And I often say to people on the state level in the EMS world, a lot of times people become, after you stay in a job for a certain period of time, you become fairly complacent. And you need new people to come in to bring new innovations, new ideas, new things. And as we begin to study the back of the ambulance and they begin to tell me, this is what can happen in an ambulance, and this is who usually gets hurt in the ambulance, I begin to work with the manufacturers, and Clint did as well, and we begin to work with Miller Coach and say, there's got to be a design here where we can redesign these seats and this bench so that paramedics or patients are not thrown around the back of this ambulance. Mm-hmm. And so we came up with the idea of forward-facing cabin chairs, captain's chairs in the back, and the paramedic can literally work from that captain's chair and never have to leave his seat. Everything's within reach in the panels. And the chances, if an accident does occur, hopefully it won't, he's strapped in. We have extremely safe stretchers that the patient is strapped in. It's so much different than it was when I was a paramedic.
Back in the 80s.
Yeah, I mean, you put one belt across them and that was it. Now we harness them in so if you were to have an accident, they don't ever leave the stretcher. And hopefully they'll be safe. But these ambulances they have side curtain airbags. I mean, they're just very safe. God forbid we ever have an accident. But you read every month of an accident somewhere. Oh, yeah. They happen. And we don't want it to happen. And we want to be, safety is number one. Mm-hmm. Patient health is number one with us. And that is the direction and the focus of where we intend to go.
Well, I understand. We mentioned Philip worked his way through college. I mentioned back in the 80s. Working as an EMT, but I understand from Clint and them at the office that he's got bragging rights. You're the longest serving. I don't think they said the oldest, and I know how old he is, but the longest serving EMT in y'all's company, right?
Yes, by far in our company. Now there are some numbers out there that are lower than my EMT number, but they are. They're a good bit older than I am.
Well, what about this picture here? Is that first ambulance you drove right here?
Yeah, right.
Is that it?
That's it. That's it. That's it.
We dug that picture up. I had to throw that on Philip up here. We like to have fun. I mean, if we can't have fun, there's something wrong. Right. Congressman Bear, a great friend to our community, he dropped by the office not long ago. I know he's a good friend of your company.
He is, and we've had some people to question Why we want Treutlen County? Well, first of all, we want it because we think that we will be able to bring a service to the county that it's never experienced before. Health care like they have in Bibb County or DeKalb County. We'll be able to bring that to Treutlen County. The other thing is we're a very poor county. Very, very poor county. And we deserve some government assistance. Mm-hmm. It's going somewhere. Yeah. Well, why not come to Soperdale? Yeah. So there are, I feel so sorry for our firefighters down there and our first responders in that county. They're working with extrication equipment that's 18 to 20 years old. Come on, guys. Mm-hmm. Let's get this figured out. We've got other counties around us that get new equipment every year. Mm-hmm. So we intend to work with the congressman, who is very friendly to Treutlen County, has always been a friend to Treutlen County, Absolutely. Just as he is to Lawrence County. Then we said, look here, you got to find us some money somewhere. Mm-hmm. We've got to have some things in this county. I was just meeting, they had me over at the hospital with their EMS director today, and he was giving us pointers on some more of the latest equipment so that we interlink with the hospital and we can link up with them and
save more lives.
Save more lives. We're going to start that EKG. If you're having a heart attack, we're going to start it before we ever leave the house. And it's feeding to the hospital. Yeah. And that doctor is going to say, I want you to push this drug into that IV. So we're going to try to dissolve that clot and stop that pain and the damage to that heart muscle before we ever leave Treutlen County.
What peace of mind. And then Dr. Vega is waiting on them at the hospital, knows the blood pressure, heart rate, great. I know you're watching us right now in Soper. What great news for Treutlen County today.
People just don't know. That's the problem.
That's why we want you to know.
Yeah, people don't know.
Yeah, you're right. And now, one thing at Choice Care, and I didn't realize that Elvis had made an appearance at a recent Christmas party or something. How did y'all get Elvis there?
We breathed life back into it.
What a company now. You want Choice Care when they can bring Elvis back to Dublin. But that's Clint Brantley. I just had to show that picture before we go. But Clint's very important to Choice Care. He served our community forever. I've known him for years. He's a Treutlen County boy. I say boy as in jest, but as you are, as Dr. Avery is, the people involved in this. And that's why you see the passion in Philip's face, because you do deserve it. We all deserve good health care. And Treutlen County, like you said, just get us up to this decade. You mentioned equipment 18 years old. That's ridiculous. I don't care. I don't care where you're at. I don't really care if you're in another state, but you're right. There's government money there. Congressman Bear, I know you watch us online a lot, so please help us in Soperdale. Please help us in Treutlen County. Before we go, Philip, somebody watching, why Choice Care? Why pick Choice Care?
Well, it's because we're on the cutting edge of technology, number one. We're bringing technology that's never been experienced before in the EMS world because we are business people. And somebody called me today from another state and said, we understand that you all are working on some technology and at a major hospital in another state, and said, we will give you our doctors to help with anything that you're doing in this arena, because we're very impressed by what we're hearing from some patent attorneys that you guys are working on. So it is all about giving back, and it's all about saving a person's life and thinking back, how many lives could we have saved? And, most people don't want to die. And most people want to live. Most people want a quality of life. And there is no reason why we can't give back. We're all about giving back. Yeah. We want to be such an outreach in our community that we don't want you to call 911 unless you need an ambulance. But if you need your blood pressure checked, you call our paramedics at the private number at the office. They'll run over and check your blood pressure. Mm-hmm. Be glad to do it, because they might prevent you from having a stroke or a heart attack. Mm-hmm. So we want to be all about giving back, care, and promoting health care in Treutlen County.
Great news, man. Thank you for joining us today. Great news, Treutlen County. You finally, and I'm 53 years old, I don't ever remember Treutlen County having advanced life support service through an ambulance service, and I could be wrong, but I don't ever remember it. So for me, for my family, for your family, your mama, for all you out there listening to us right now, if you travel through Treutlen County, as soon as it gets swapped over, at least we'll be at that stage where finally we'll have advanced life support system. And going back to what we said, what great peace of mind, Philip. I mean, what great peace of mind. Choice Care Ambulance Service, one of our largest employees, and hiring more all the time. I'm telling you, got about 45 just EMTs, don't you?
65.
65, Lord. I got to get him back more often. Thank you, Philip.
Yeah,
thank you very much. Philip Jennings from Soperton, thanks again, and thank you for joining us.